CHIP is a entity that is being more and more recognized recently. It's been initially associated with worse outcome, cardiovascular outcome in the general population, and more recently there has been growing interest to see the impact of the presence of CHIP in patients with hematological malignancies. So in the context of myeloma, we already know that there seems to be some worse outcome for patients undergoing transplantation and harboring a CHIP. Similarly, there has been some data for patients with lymphoma, but in the context of amyloidosis, it's much less clear the role of CHIP presence. Also, it's not entirely clear the frequency of CHIP presence. So far, some studies try to assess the presence of CHIP in patients with amyloidosis, and no clear impact in terms of prognosis has been identified, but these studies were small and with short follow-up. We try also to look at the presence of CHIP in a cohort of amyloidosis patients, and we were able to do this, me together with the mentorship of Dr. Giada Bianchi from Dana-Farber, and through the collaboration of Dr. Bolli from University of Milan. So again, we look at this cohort of amyloidosis patient. It's probably the largest cohort so far, meaning that we were able to look at a total of 70 patients, and approximately 20% were found to have CHIP, and we found some association between the presence of CHIP and the presence of a translocation, which is usually associated with lower outcome in amyloidosis patients, and together with that we also found an interesting association with a lower renal stage, lower Palladini renal stage in patients with amyloidosis. So these are preliminary data. We're still trying to explore the significance of these findings. We also try to explore any impact of CHIP in patient amyloidosis in terms of prognosis, and we were unable to find any meaningful impact on the prognosis so far. But again, follow-up time is still short, and unfortunately the cohort is still small. So we are hopeful to gather more data in the future, and further clarify the impact of CHIP in this cohort of patients.